All right, I'd come in, knock, knock, knock. I would come in and say, hi, my name is Abby. I'm going to be your nurse today. I'm washing my hands, and then I would ask to see the mom and baby's wristbands to make sure they match. Mom, can I have your name and date of birth? Baby's name and birth? Okay, bracelets match. All right, I'm going to pull the curtain for privacy. I'm here to do a assessment on your baby today. That's why I'm here. First thing I'm going to do, cover the baby to listen to its heart sounds. I'm going to listen to the apical pulse for a full minute. The regular apical pulse heart rate for a newborn is 110 to 160 beats per minute. Listen for time. The baby's heart rate is 125 beats per minute, regular, strong, no abnormalities and no murmurs have been heard. Next thing I'm going to do is I'm going to listen to the baby's breath sounds. Anterior and posteriorly, 5 on the front, 5 on the back. Oh, no, sorry, not right. Right, and right. Same thing, posterior. To the right, right, right. Breath sounds are clear. No crackles, wheezes were heard. So what I'm going to do is I am going to assess respirations. Normal respirations are 30 to 60 beats per minute. Okay, these respirations were 42 beats per minute. They were even, regular, and unlabored, which is normal. There's no signs of respiratory distress, such as nasal flaring, grunting. There's equal chest expansion and no retractions. Next thing I am going to do is I am to auscultate the vowel sounds. All 4 quadrants. Left upper, right lower, and left lower quadrant. All vowel sounds are active in all 4 quadrants, which is normal. Next thing I am going to do, I'm going to look at the baby's mouth and nose for any secretions. In the mouth, there's no secretions present. The mucous membranes are pink, moist, and intact. The lips are pink and intact as well. The nares are patent, and there's no abnormal discharge there either. Next, I'm going to look at the eyes. The sclera is white. Conjunctiva is pink. The outer canthus lines up with the upper pinna of the ear. I'm then going to look at the fontanelle sutures. The anterior fontanelle is soft. The posterior fontanelle is soft. Sutures. And then there is also equal hair distribution present as well. Next, what I'm going to do is I'm going to palpate the abdomen. Abdomen is not extended, no tendons, bulges, or masses present. I'm now going to palpate for the bladder. Bladder is not distended. You're unable to feel it, which is normal. Next, I am going to check the nail beds on lower and upper extremities bilateral. There's no cyanosis present. I'm also going to check caprico, upper and lower extremities as well. Refill is brisk, less than 3 seconds, all extremities bilateral. I'm going to assess extremities for edema, redness, and warmth. No edema is present, no redness, and the extremities are warm. I'm going to inspect the skin all over. It's warm and red, warm and pink, redness, and no swelling. There's also no abnormalities noted. And then I'm going to flip the baby over and look for spinal forming, for the spinal alignment. Spine is aligned. We're going to look at the coccyx for any sacral dimple or an abnormal tuft of hair. Neither are present. I'm also going to observe for any lesions. I do not see any lesions or lacerations or masses or bulges as well. Mom, has the baby had a bowel movement yet? Yes, okay. What did it look like? Black and sticky? Well, that is normal. That is called a meconium stool. That's the first stool they're going to pass. So that is completely normal. Has the baby urinated yet? Yes, okay. And what was the color? Orange yellow? Okay, that's normal. Was it large, medium, or small? Medium. Any odor? No. Bowel movement too. Was it large, medium, or small? Medium. Okay. All right. That is all normal. Next, what I'm going to do is I'm check the diaper area. Now, if it's a female, you would look at the labia. And the labia majora should be bigger than labia minora. There should be no abnormal discharge. For a male, you would look at the circumcision. There should be no redness, no bleeding, no abnormal discharge, and no odor, so no signs of infection. And next, I'm going to look at the penis, and it is patent, dry, and there is no skin breakdown. It's intact as well. I'm also going to look at the baby's umbilical cord. No abnormal drainage, no odor, no redness, and no bleeding and swelling, so no signs of infection there. Extremities and skin have cyanosis. Okay, next thing we are going to do is we are going to do reflexes. Okay, the first reflex we are going to do is the rooting reflex. You swipe your finger on the side of their mouth and they will turn and look like they're rooting for a breast. This baby has the rooting reflex. He turned and he's going to root for a breast. The next reflex, which we're going to have a new gloved finger, you're going to put in the baby's mouth. And this is a sucking reflex, and they should automatically suck, which this baby is doing. And when I withdraw my finger, I'm going to rub against the palate to see if it has fuse. So I'm going to withdraw my finger, rub against the palate, and the palate has fuse. The next one I'm going to do is the palm reflex. I'm going to put my fingers in their hand, and they should grab my finger, take it, okay, bilaterally, and the rooting was bilaterally as well. Next, we are going to do the plantar. I'm going to put my finger under their toes, and they should curl. They should do over here as well. And the plantar reflex is present bilaterally. Next, we are going to do is the Babinski, and I'm going to rub my finger up the side, so up towards the big toe and around the bottom of the foot on each foot. Rub up against the big toe and around the bottom of the foot. The toes should fan out. Toes fanned out and went back, so the Babinski reflex is present. Next reflex that I am going to do is Mara. So what I would do is I would set the baby in a bassinet at the side of the bassinet. Mara reflex, the baby should startle and flail their arms out and draw them back in, and this baby did. So the Mara reflex is present bilaterally as well. I'm also going to take the baby's temperature. Okay, and you're going to do auxiliary. You're going to put it under the auxiliary parallel to the body. Regular temperature reading is 97.5 to 99.7. Temperature is 92, which is within range. The next thing I'm going to do is I'm going to teach the mom how to use a ball sucker. What you do is you would do the mouth first before the nose. You're going to decompress the ball away from the baby. You're going to put it to one cheek, withdraw, and wipe the secretions on it. Other cheek, draw, wipe the secretions on it. Now we're going to move to the nose. One nostril, draw, wipe on napkin. Other nostril, draw, okay. Always do the mouth first when it comes to ball suction. Okay, that concludes my assessment. I am going to go ahead and wrap the baby back up. Oh, and mom, the teaching point for you, this is something you should call the provider. If what's going to happen is when you go home, the baby should have 6 to 8 wet diapers a day. If not, please call the doctor. I'll put the baby's hat back on. And mom, would you like the baby, or would you like me to take the baby to the nursery? If you want me to take the baby to the nursery, I can do that for you. Do you need anything? No? Okay. Well, your call light is within reach, so if you need anything, just give me a call and I will be here. Thank you.